Welcome back. Time for Health Watch, and February is Heart Awareness Month, a month dedicated to learning ways to keep your heart healthy.
And as Shelley Botat tells us, that includes learning to take good care of your arteries.
Vascular disease is split into coronary disease, which is blockages in the heart arteries, and peripheral disease, which is blockages in the arteries everywhere else in your body. And like with coronary disease, doctors can use stents to fix the blockage.
I was having numbness in my toes, which then ended up cramping in my toes, and then the foot would go numb, and my calf would go numb and get tight like a Charlie horse.
The pain was debilitating for Keith Rabarchek.
That feeling of numbness and tightness and the pain and not being able to walk, I have to stop every 10, 15 feet and let it rest for a minute or two.
Keith didn't know what was wrong.
No, had no idea. I thought it was a bad pair of shoes, so I tried different shoes, different orthotics. Nothing seemed to work.
That's when he went to Dr. Scott Weslow, an interventional cardiologist at Aurora BayCare Medical Center. Dr. Weslow found that Keith had PAD, peripheral arterial disease. Plaque had built up in his leg artery, blocking blood flow.
Peripheral arterial disease is manifested by pain in the legs, either with exertion or at rest if it's very severe. This limits people's lifestyles.
Dr. Weslow performed an angioplasty at Aurora BayCare, putting stents in Keith's leg artery to open them up and increase blood flow.
I saw him after we were able to open up. He had a totally occluded leg artery, and we were able to open it up. I saw him 2 weeks later. He was back at work without any limitations at all and no pain.
PAD is caused by the same thing heart disease is.
The big five would be diabetes, high blood pressure, high cholesterol, smoking, and a strong family history.
Now, life is a lot different for Keith. He quit smoking and is now taking the stairs with ease.
I walk about 3 miles a day.
Dr. Weslow wants people to be aware that if you have pain in your legs and it is from a blockage, it could be a sign that you could have blockages elsewhere in your body, like in your heart.
Thanks, Shelley. And to learn more about Aurora BayCare's Heart, Lung, and Vascular Center, call 1-866-938-0035 or email healthwatch@aurorabaycare.com.
And tomorrow in Health Watch, it takes patients' breaths away and can be fatal. A new therapy for a lung condition that has patients and doctors excited.